Hello, Dr. Nick with episode 12 in the series, The Wonder of Sleep. And today I'd like to turn my attention to something that tends to bug me a little bit, and that is how a lot of people wear short sleep or sleep restriction as a bit of a badge of honor. And I recall just recently having a conversation with around 3 or 4 people who were almost bragging about how little sleep they get. Now, every single one of these people were in very poor healthy condition. And, it just blows me away how little they understand about what sleep can do to your body as far as sleep restriction is concerned. Now, way back in 2004, Dr. Evan Courter and her colleagues from the University of Chicago started doing some very interesting research. And basically, they got a group of young, fit, healthy males around the age of 22 years old, not type 2 diabetic at all, very good blood sugar levels. In that experiment, they restricted their sleep for 6 nights down to 4 hours sleep a night. And within that 1 week of short sleep, or it was actually 6 nights of short sleep, they all went to basically a pre-diabetic range with blood sugar. They had increased levels of ghrelin. Ghrelin's a hormone that makes you extra hungry. Decreased levels of leptin. Leptin's another hormone that tells your brain, stop eating, you've got enough energy in your fat stores, you don't need to eat anymore. And the beauty of that research, apart from those very poor findings, was that the following week, they were able to sleep as long as they could to catch up. And these guys averaged about 9.3 hours of sleep for the next week and all returned to very favorable blood sugar levels. So everything seemed to be reversed with that catch up of sleep. Now, they didn't pay back the 3.5 hours sleep that they were short every night, but we've known from a lot of research, you don't have to pay it back dollar for dollar. Now, very importantly, that was the very first research project that I know of that showed that short sleep, even for a small period of time, can increase your risk of type 2 diabetes. There's been plenty of other research projects around that have supported this. Dr. Evan Courter also did another project around 2007 where she got a similar age range of very healthy young males, subjected them to 3 nights of sleep, 8 hours of sleep, but no deep sleep at all. It was there that we discovered that it was that lack of human growth hormone, which is normally produced when a male sleeps in deep sleep. That lack of deep sleep cut down the human growth hormone to the point where the cells of the body were becoming glucose intolerant, again leading to high levels of blood sugar. The reason for the high levels of blood sugar is because the cells could not literally process the glucose, and it was basically rejected from the cells. Now, this was way back in 2004 and 2007, and there have been a range of research projects since that have supported the notion that short sleep can and likely will increase your risk of getting type 2 diabetes. Now, it's hard enough going through life. Certainly, once you get to your 40s and 50s, you really need to start looking after your health. You cannot do that if you are sleeping this 5 or 6 hours of sleep that people wear as this badge of honor. It's ridiculous. You will not remain healthy. So, as I keep on alluding to, if you want to become and remain the best version you can be, then a good, healthy Mediterranean style diet, plenty of movement, at least 30 minutes of good physical movement every day, and ensure you get that 7.5 hours of sleep on average every night, and you will be the best you can possibly be. Not only will you do good things for your body, but you will also reduce the brain from aging quicker than it needs to. So that's this episode in a nutshell. 7.5 hours of sleep every night will keep you as low risk as possible for developing type 2 diabetes. And you don't want that stuff because it is a nasty disorder that causes all sorts of damage to your bodies, your eyes, your kidneys, your limbs, your cardiovascular. Everything bad can come from type 2 diabetes. And even recently, there is a lot of scientists talking about how one of the number one contributors to dementia is living with type 2 diabetes. So try and avoid it where you can, get your good sleep, and if you can't sleep well, get help from people who can help you. And if you can't find anyone that can, send me an email. I'll give it my best shot. Signing off for this week. Have a great week.